Smriti Chaudhary will be presenting on eyes ODYSSEY, retinal vasculitis in a patient with autoimmune hepatitis and MCTD. Over to you.
Good afternoon, everyone. I am Dr. Smriti Chaudhary, second year ophthalmology resident, and today I'll be taking you through the eyes odyssey. So there are no financial interest or conflicts of interest in the subject matter, and all appropriate informed consents were obtained from the patient. So autoimmune liver disease is a chronic disease which affects eyes as a part of the autoimmune process. Corrective conjunctivitis sicca is the most common ocular manifestation, whereas cataract is the most common complication of autoimmune liver disease due to the corticosteroid treatment. So retina is involved as a part of posterior uveitis, which manifests as retinal whitening, vasculitis, hemorrhages, macular edema, and chorioretinal lesions. The correlations between AIH and uveitis with the other systemic diseases has been well established, but not those between them. So there have been only 11 cases documented globally that point to autoimmune hepatitis as a cause of uveitis. So an ophthalmologist's role is emphasized by the possibility that ocular involvement may be correlated with the systemic disease activity and progression and may occur before the systemic symptoms. So here we present to you a rare case of retinal vasculitis and branch retinal artery occlusion in a patient of autoimmune hepatitis and mixed connective tissue disease. So a 39 years old female patient presented to IOPD with chief complaints of blurring of vision and flashes in left eye since 3 months. It was sudden in onset, painless and progressive, and she also complained of straight lines appearing wavy. So she was a known case of decompensated liver cirrhosis and autoimmune hepatitis with portal hypertension and hypothyroidism. On further workup, she was also found to have mixed connective tissue disorder due to anti-RNP and anti-double stranded DNA positivity. So her ocular examination showed best corrective visual acuity in right eye as 6.6 N6, while in left eye it was 6 by 60 and N36. So the anterior segment examination right eye was within normal limits, while the fundus examination showed venous sheathing and few hemorrhages in the temporal periphery. The disc and macula were normal in the right eye. So here is the fundus photo. I apologize for the bad quality of the fundus photo. So the anterior segment examination of left eye showed grade 1 RAPD and rest was normal, while the dilated fundus examination showed a pale disc, the foveal reflex was absent, and there was arteriolar narrowing and sheathing of inferotemporal branch of retinal artery. So here's a fundus photo of left eye. So Amsler's test and color vision test were abnormal in the left eye. The Schirmer test revealed bilateral severe dry eyes. So Humphrey field analysis was not reliable in this patient, but OCT macula showed foveal thinning, as you can see here, and there's also widened foveal contour in the left eye. So sorry. So here's a picture of OCT angiography of the patient showing areas of capillary dropouts due to the vasculitis. So she was diagnosed with right eye vasculitis and left eye old branch retinal artery occlusion. So although it affects people of all ages, autoimmune hepatitis has been found to be more common in women than men. Rheumatoid arthritis, ulcerative colitis, and thyroiditis are the few examples which are often linked to AIH. So uveitis, however, has not been established much as an extrahepatic manifestation of AIH. So bilateral chronic persistent panuveitis is the typical first sign which needs an aggressive treatment. So retinal vasculitis involving the inflammation of vessels is a sight-threatening condition. So cotton wool spots, perivascular sheathing with inflammatory exudates, and retinal hemorrhages and occlusion are the hallmarks of retinal vasculitis. It is a clinical diagnosis that we confirm with OCT and FFA. So to find the etiology, we need a multidisciplinary approach along with lab investigations. So majority of AIH patients need a long maintenance therapy, and milder disease is found to have better response to treatment. Corticosteroids with immunosuppressants are the treatment of choice, followed by low-dose steroid therapy to avoid any remissions. Here our patient was started on systemic steroids and immunosuppressants after rheumatology clearance, and she was also started on antiplatelets later due to anti-beta-2 glycoprotein and anti-dsDNA positivity. So she was also prescribed artificial tears 4 times a day. She has been on regular follow with gastroenterology and ophthalmology departments. So the moral of the story is that uveitis should be ruled out in all cases of proven autoimmune hepatitis, and autoimmune hepatitis should be included in the differential diagnosis of all cases presenting with uveitis-like features. So I would like to thank Dr. Shailaja, my associate professor, and Dr. Yogesh Kamath, unit chief and head of department of the ophthalmology at Kasturba Medical College, Manipal, for their valuable support and guidance and granting me the permission to present this paper. I would like to thank All India Ophthalmology Society for giving me the platform to present this paper. So these are my references. Thank you.
Do we have Dr. Shreyas TS here? So nice presentation, good documentation.
Thank you, sir.
Only thing is there is a bit of generalization which you have done. That is branch retinal arterial occlusion just going by the sheathing which has happened. That kind of sheathing on the OCT picture can be because of the perivascular exudates and vasculitis which takes place and then heals. And also the macula OCT picture what you are showing, you can see it following any retinochoroiditis or subsequent to the resolution of inflammatory macular edema. So you can for sure put it as a branch retinal artery occlusion only if you have documented in acute stage.
Okay, sir.
Okay, and yes, the point usually case reports stand last in the evidence, but because this is a unique case where one has ophthalmologist has to be aware of the autoimmune hepatitis patients needs to be the eye evaluation is important. So this is a message has to be driven to the rheumatologist and
Yes,
the team who deal with the vasculitis.
Yes.
Nice presentation.
Thank you.